like prior authorization, step therapy, and treatment denials, affect access to care and patients' well-being. The purpose of this program is powerful: to make sure that patients' and caregivers' voice is not just a part of the conversation about access and coverage, but it is the center of the conversation. About cancer support community. I want to just share a little bit about cancer support community if you're not familiar, or we like to also be known as CSC. It's a global network dedicated to uplifting and strengthening people impacted by cancer. Our mission, our vision is that everyone affected by cancer, no matter who they are or where they live, receives the support they need throughout their experience. We are the largest provider of social and emotional support services for people with cancer and their loved ones. Our programs are grounded in the understanding that cancer doesn't just affect the body, it affects every part of life. And our goal is to ensure that no one faces cancer alone. Through our network of more than 200 cancer support communities and Gilda's Club locations in 50 markets, along with our toll-free helpline, digital programs, and educational resources, we provide more than 50 million in free services each year to patients and their families. At this point, I'm delighted to introduce Sarah Baldwin, who is the program director here at our Cancer Support Community North Texas location, who will just share a few words about the incredible work being done just right here in Texas.
Thank you so much for that warm introduction. It's lovely to have so many people here in our community room tonight. As mentioned, my name is Sarah Baldwin. I work as the program director here with CSCNT. Just like all of our network partners, we offer a wide variety of no-cost support services. These include things like our support groups, short-term individual counseling, lovely social events, educational programming, healthy lifestyle programs, and resource navigation. On top of that, I'm excited to share some exciting announcements. We will be relocating in 2026 to a new location. It's going to be just about 5 miles, 10 minutes down the road. So if you're local in the area, you'll still be able to receive that boots on the ground, Dallas-based great support. We're also starting a new teen support group. So if there's any teenagers in your lives, please feel free to send them our way. And again, we're so excited to have you here talking about this very important topic tonight.
Thank you. At CSC's Cancer Policy Institute, or CPI, the focus is on translating what patients experience every day into policy change that improves access and equity in cancer care. The work is guided by the voices of patients, caregivers, and survivors, those who know firsthand what it means to navigate insurance denials, work with appeal decisions, and face delays while waiting for treatment to be approved. Again, we take those live and lived experiences and combine them with evidence from CSC's Research and Training Institute, and we use them to inform policymakers, payers, and providers about what really truly matters to patients. Whether it's on Capitol Hill, in state legislators, or in meetings with the regulators, the goal is to make sure that every decision from coverage to care delivery reflects what patients need, not just what the system dictates. Connecting policy to people. And tonight is about that, is about connecting policy to people, putting the faces on how policy impacts people. When we talk about terms like step therapy, prior authorization, and treatment denial, we are talking broadly about utilization management. And it can sound very technical, but behind every policy, there's a person, someone who's waiting for an answer, someone who's missing work, someone who's scared their cancer is progressing, while the paperwork is being sorted out. Our goal with Patients Over Paperwork is to shed light on these real experiences, both those for those living with cancer and those caring for them. So our goal is to help them understand how these insurance rules play out in everyday care, and that those stories inform better policy and strengthen advocacy. Tonight, you'll hear from healthcare providers who navigate these rules every day, and from patients who live this reality. So at this time, we want to thank you, give a thank you to our network, our CSC network, our advocacy partners, and our sponsor, B1, whose support make this critical conversation possible. Before turning things over to our moderator, I want to just do some housekeeping. If you are in the need of a restroom, please go to the right outside of this door and continue down the hallway to your right. If you have your phone, please turn it on silent. If you have to take a call, we please ask you to step away. But it's really an important conversation tonight. So I hope that you will be present and fully engaged in the dialogue. We will have a question and answer period with the audience following our moderated panel discussion. And those of you who are joining us virtually, we appreciate your time and ask that you put your questions in the chat, and we will read them to the panelists. And at this time, it is my pleasure to introduce our moderator for the evening's discussion, Ivy Ahmed, who will lead our panel conversation exploring how we can work together to ensure that patients and families can focus on healing and not fighting insurance. Thank you, and help me welcome Ivy.
Thank you so much for joining us, and thank you, Linda, for that warm welcome. I am thrilled to be here tonight, and as Linda said, this is our fourth program. This is actually our third of the week, and this has been such a powerful week to talk about decisions that impact patients that aren't necessarily made by them. And so tonight, I am excited to be able to welcome 3 individuals who have amazing experience and perspectives, but who are channeling that to help change a system that keeps patients at the center. We're going to talk about the impact that these types of decisions have on individuals, on the burden to the system, and then how can we make changes that really help to move the system and ensure that patients and their loved ones are really making decisions in partnership with their providers. I'm going to introduce our panel. We have George Valentine, who is joining us. He's a patient advocate for those living with cancer and their loved ones. We have Deanne Carmichael, who serves as the Director of Ambulatory and Specialty Pharmacy at UT Southwestern Medical Center. And then remotely, we have Zia Kam, who is the Director of Pharmacy at the START Center for Cancer Care in San Antonio. So in this unique setup, what I'm going to do is ask each of our panelists to introduce themselves, tell us a little bit about their tie to cancer and really why they're here tonight. And then I'm going to ask our panelists some questions. So I'm going to start with you, George.
Thank you. Can everyone hear me? So I'm George Valentine. In 2002, doing a regular physical, I was diagnosed with chronic lymphocytic leukemia. And I've been in treatment for that for the last 23 years. So for the next 3 days, I'm going to tell you all about all. Let me tell you for 3 days. Yes. Okay. Sorry. No, but I've been through hundreds, I would say hundreds of actual treatments for my leukemia. I've probably been several hundred lab tests over the years. I've dealt with, 3 different pharmacies, one for specialty, one for regular pharmacy stuff, and one for, different, things that have to be mixed and stuff like that. So I have 3 different pharmacies. I've got 10 different doctors. And I've dealt with insurance companies, both through my employment at the time and then through Medicare after I retired in 2019. Somewhere along the line, I discovered that I've been blessed. I've been given a lot of extra time. When I was first diagnosed, I was told that I had 5 years to survive with chronic lymphocytic leukemia. And here I am 23 years later, and I'm doing great. But it occurred to me, what are you doing with this extra time? So I decided I would advocate. I would find people who were fighting for access to treatment, access to drugs, better cost for drugs and treatment and things like that. And so I started reaching out to different organizations to say, you know, I've got a story. If that story has some value, you know, give me the platform and I'll be more than happy to share the story. There's another reason why I advocate, and I'll talk about the advocate stuff later, but advocacy stuff later, but there's another reason that I'll share with you. Edward Joseph Valentine, Sharon Valentine, Catherine Valentine. 2 of those are my siblings that died from cancer. And then the other one's my mother, who died from breast cancer, but she was 85 and chose not to get treatment for that. I also have a sister, Teresa Valentine, who is a breast cancer survivor. So cancer is real in my family. And what I want any and every one of my family members to know that if something comes up and you get cancer tomorrow, you'll know that somebody's out there fighting for you to make sure that whatever journey you're about to embark on, that I'll do whatever I can to make that journey better than the journey that I embarked on.
Fine is interesting, but I'm Deanne Carmichael. I'm the Director of Specialty and Ambulatory Pharmacy at UT Southwestern Medical Center. I've been there for 8 years. I've been there, my tie to cancer is that I have the cancer specialty pharmacy under my arm. I helped develop and build that business base there at UT Southwestern and the teams that are on there. We have one specific team that is vital tonight to talk about is our specialty medication access team. Team of pharmacy technicians, and they work tirelessly on prior authorizations, financial assistance, any kind of patient information to get to that patient through the manufacturers. And so they're our stars when it comes to the cancer treatment, especially because of all that they're doing. So that is my tie, and there we go. I guess I don't have to pass the microphone to you, do I?
Are you able to hear it?
Would I be next? Sorry, I'm just
Yes, you can be next.
sorry, I couldn't hear. Hi, everyone. Thank you so much for having me on your panel today. My name is Zia Khan. I'm the Director of Pharmacy with the START Center for Cancer Care. We're a multi-specialty community oncology clinic in San Antonio. I lead the pharmacy department. I oversee the pharmacy day-to-day operations and anything to do with the pharmacy department. I have 2 IV infusion centers under my I would say purview, along with a specialty oral oncolytic pharmacy. I'm actually glad to be a part of this panel because we see the challenges that our patients face every single day when it comes to prior authorizations and any kind of financial obstacles that they have to go through in order to get their really needed treatment. I had a a family member really dear to me. Unfortunately, he passed away last year. He was an uncle who raised me like his own son. He actually had a bladder cancer that metastasized over time. And the last 3 years of his life were very challenging, especially with everything that he had to deal with for getting his cancer treatments. So I have this approach of trying to do whatever I can, and and as a cancer center that I'm part of, we do everything that we can to make sure that we facilitate our patients to get the best treatment possible, and that includes a very dedicated team, a group of people, starting with the technicians to the pharmacist and everybody in the ecosystem, the physicians, financial counselors, and anybody that has a touch point with those patients. Our goal is to make sure that we can get the treatment in a timely manner, as quickly as possible, as efficiently as possible to our patients. And nowadays, unfortunately, with all the challenges that the patients are facing with insurances and other hurdles, it requires a lot more dedication and attention from the pharmacy team. And I'm glad that I'm able to provide that. So glad to be at the panel today as well. Thank you.
So with that, you are all very dedicated and involved in different ways across the cancer space. And I'm going to start with George to have you, tell us a little bit about your experience individually, but also your experience in helping patients as an advocate. How have you seen insurance delays and denials, step therapy impact their care and their journey?
So insurance. Over the last 23 years, I've had to deal with different challenges around insurance. One, I look at the cost of premiums over those years have gone up. My out-of-pocket, the burden that I had for that has gone up over the years. And things change every year from an insurance perspective. So with my leukemia, they put me on a pill, and then a few years later, that pill went sideways. That's just the way it works. And I had to go to another pill. And a few years after that, I had to go to another pill. So with step therapy, here's one of the challenges. If you walked in today and said, why do I need to go through the first pill, the second pill, the third pill, the fourth pill? Why don't I just start at the top? Because that's the best pill with the least amount of side effects. No, the insurance company requires that you start at the minimum and fail at that, and then go to the next one and fail at that before they would approve the best pill that's available in the marketplace today. The other thing is prior authorization. Prior authorization says, listen, we will provide that drug for you, but we would like to prior authorize the use of that drug. The reason for that is insurance companies have doctors on their staff. Okay, so George comes in, George's doctor says, George, you need this drug. And I send that to the insurance company, and the insurance company sends it to their doctor. And the doctor says, well, has George done this? Have you tried this treatment course? Are we just going to the top because George is a Medicare guy with big pockets or whatever? So prior authorization is a process that insurance companies use to ensure that the treatment that the doctor prescribes and the drugs that the doctor prescribes are in line with what I would call generally accepted procedures and processes. So from a patient perspective, the question is, well, what do we do about that? Well, number one, you get a drug plan, and we're coming up on new drug plans for most of you, whether you're in private or Medicare. Read the plan. I can't stress that. Read the plan. Read every sentence in the plan, because it's all there. It tells you when prior authorization is required. it tells you if step therapy might be part of it. It tells you if you can get this pill, you've been getting it for 90 days, well, now you can only get it for 30 days. Don't know why, but that's what is in the plan. I would say read the plan. The broader thing that I would share with you is be your own advocate. Don't be afraid to advocate for yourself. When you sit down and talk to the doctor and he says, oh, George, I'm going to move you to this new medication. I say, how'd you come up with that? What were the options that you considered? How many patients do you have on that option? What does it cost? And what resources are available to me to help me with that out-of-pocket cost? Simple questions, right? If the doctor can't answer it, find a new doctor, right? I mean, there's not a, that's you advocating for yourself. The other thing about advocating for yourself is you know the quality of life that you require, right? You know it better than anybody. And when you sit down across from your doctor, tell them, this is what I want. I don't want to come in here every week and get stuck in the arm. I can't do it. I got a job, I got a family, I can't come in here. So whatever solution you come up with as to support the fact that I just can't be here every week. That's an example of me advocating for myself, and my doctor's taking care of my physical body, but he also needs to take care of my mental and emotional health as well. And there's numerous more stories. I don't want to take up a whole bunch of your time that I can certainly tell you about advocating for yourself. It starts with reading the plan and understanding the plan so that you don't have those surprises from the insurance company.
Low, back and forth. So thank you, George. That is such an empowering message for people to hear and to know that it can be done. I am not fond of those plans that you right to sleep, but I applaud you for being able to get through them. Maybe that's a good that's a good use of AI, maybe. Take a look at it and analyze it for you. So I do want to ask Deanne about, George has talked about a lot of work that falls on patients and making decisions, and then in that negotiating with their provider, but it seems like it's your team, right, that you manage that's actually doing that work on the front line. They sound like rock stars. There's just that is a lot of heavy lifting. Can you tell us what that takes from your team and like what, sort of what it's like for them on a day-to-day basis and, just how challenging it can be?
Truly is the process for the prescription. Doctor decides what your treatment is going to be, send the prescription to the pharmacy, and then there's a threaded prior authorization is required. So that is going to be sent to our technicians that are going to handle this for you. And they go through answering all of those questions. They get into your electronic medical record. They look at the doctor's notes. They look at all your lab work. They check all of these things. They're answering all of the questions as you go. And then they submit to the insurance company. And then we wait. And then sometimes it goes on through and it might be a higher copay, or sometimes it doesn't go through and now we need to go do an appeal or we need to change therapy. There can be delays all along the way. About the higher copays, if it comes back very high, different things, then it goes to another group within this team that, sorry. Then it goes to another group within this team that handles financial assistance. And so they go out there to all of the different grants and the different manufacturers, and they pull money to help with these copays to make sure that this therapy that the doctor deemed as the appropriate therapy is going to be able to be taken by that patient. Whenever there are denials on these prior authorizations, our team doesn't necessarily do the full appeal, but they get those ready for the doctors. And that can take up to a month because sometimes they have to do a peer-to-peer, and just to make sure that they do that. But when we can finally get that to the patient, and it takes about a 3-day turnaround within our team to get those out to the patient, and to get them on that therapy just as quick as possible. Being within the hospital system, it does make it a little bit quicker because we do have that access to that EMR. One good thing about our team too is that we do all of that work. And then if we get to the very end and your insurance says, oh, I'm sorry, you need to go to a Credo, or you need to go to a different specialty pharmacy. My team has done all of that work and they send it on and it is ready to fill by that specialty pharmacy. So we wanted to stop those delays as much as possible. And this team worked so hard on getting it there.
Thank you. Wow, that's a lot of work. I mean, I really didn't know I know there's a lot going on in the background, but it's an immense amount of paperwork. And it's really, it does sound so burdensome on your team, but also, having the patients think about what that takes. So, Zia, I don't know if you can hear me.
I can hear you now.
Okay, we can't see you, just so you know.
Oh, sorry, I don't know what happened.
It's okay.
Hang on. Okay, can you see me now?
Yes, we can. Thank you.
Yeah.
So you certainly have really a pretty big responsibility in managing all of these different moving parts. And, I'd like to have you talk to us about sort of the burden in the system, right? The healthcare system, and how, all of this increasing responsibility, the engagement back and forth, how that really, takes a toll on, the overall healthcare system, but also in your institution.
So, I think you asked how all of the challenges take a toll on, from the healthcare system. Are they taking a toll on the patient or the provider?
From the provider side.
Pardon me?
Provider side.
Okay, so I believe the other two speakers kind of touched upon this. So one of the challenges that we see all the time is, and that's where it was mentioned earlier that the patients, it would be great, we always encourage our patients to be their advocates, that advocate for yourself, because unfortunately what we see is, going back a little further, I would say, to prior authorization when that was discussed. Prior authorizations, when they were first created, they were meant to be it wasn't meant to be applied for every single situation. They were very specific, where a particular diagnosis required it, where a doctor had multiple options perhaps, and the best treatment clinically had to be chosen, and there was a layer to that decision making. Unfortunately, because now we're seeing a lot of this applied upfront for no matter what treatment a patient gets. So if the patient's coming in for treatment for, let's say, follicular lymphoma, or a CLL or CML, no matter what oral drug the physician's providing, most insurance plans are requiring a prior authorization, which delays care in most cases. Doctors do understand that they're trying to provide the best treatment for their patient, and they are doing their due diligence, but unfortunately, these barriers do provide a burden on their side, where there's a lot of work that goes around. And then I know the other speaker also mentioned it, where the teams have to engage with the insurance company, get the paperwork submitted, which requires documentation to show that there is an actual disease where the patient's being treated for that particular diagnosis, and to get an approval in place. Unfortunately, sometimes we see, because of the step edits and preferred networks, where an insurance provider may require a patient to get their prescription filled somewhere else, perhaps a specialty pharmacy that's not the one that is associated with the physician. It can possibly cause for patients to have to wait for their medication, even though the pharmacy that has initiated the prior authorization already received it, they just can't fill the drug. So as far as the healthcare team, which includes the physician, the nurses, the pharmacist, who are trying really hard to get the medication into the patient's hand as quickly as possible, because there's a different outside entity now involved who is supposed to take over and then dispense these medications, there is a disconnect that oftentimes happens, where physicians expecting the patient to start their medication as early as possible. Perhaps if the patient was seen today, Thursday, and earliest they could possibly start if it was within the clinic would be the next day or the same day. because of these outside entities now being involved, patient may not even see their drug for up to a week. And that's very challenging. That's where we educate our patients to pick up the phone, be their own advocate if they can, to fight that battle where sometimes if they're able to get an override, at least so that they can get their medication the fastest possible. And along with those barriers, what we also see is, the local team, they're trying really hard to engage the physician and engage the insurance, engage the drug company to get any kind of financial assistance possible. And oftentimes we see situations where if an outside pharmacy, specialty pharmacy, is filling that prescription, they may not be going that extra step. They may not be engaging into that possibility of trying to get the patient additional assistance through funding, through grants, where a patient's copay could possibly be very minimal or completely no copay at all. So those are some of the barriers that do cause a lot of, I would say, strain on the healthcare system. And we're hoping that more and more awareness and educational opportunities like this, where we can directly engage as, with patients, with the other providers, where we can get the word out, where we need to find better solutions for our patients.
Thank you. It is definitely a burden. And I actually want to continue to have you tell us a little bit more. You mentioned about, the fact that your team educates patients on how to address these barriers. Can you tell us how they do that?
Your question was, how does our team educate the patient to address these barriers?
Yeah.
Okay, so whenever we have a challenge where a patient may not be able to get their medication right away through the pharmacy, we have a very frank discussion with our patient to let them know what we're seeing as a barrier, as an issue that can perhaps slow down the patient's ability to get their medication. And we provide resources to them and say, hey, we're doing this. We're engaging with your insurance provider, try to get an override. Here's a number where you can call, perhaps as a member from your member services side, that you can then meet us halfway. When patients call the insurance companies, they're way more effective so that we can get a response quicker than when we're trying to do it on our end. Unfortunately, this was mentioned earlier, where when prior authorization is submitted, there is a physician or another doctor on the insurance side who's reviewing the case. That's not always the case. This is a process where you'll have somebody who is a non-physician, oftentimes, that is working that prior authorization on their end initially. It may be it could be a technician, it could be a non-medical person who is just following a prompt to whether a prescription can be accepted or denied based on criteria where a therapy is covered, maybe it's a step edit. And just to go through those layers from the pharmacy side, from the provider side, there's a lot of additional steps. Whereas when a patient is able to then call the plan directly through the member services, there is almost a possibility where they're able to jump a lot of those steps and force the issue where they're able to get their medication faster, sooner, through the provider of choice.
So definitely the opportunity for patients to advocate on themselves makes a difference. Advocate on their own behalf, that makes a difference.
And we guide them the entire process if we're able to. Just a lot of communication, and that's where any cancer practice that is truly moving the needle for their patient, there has to be a lot of open communication, and sometimes multiple phone calls, if they're within the clinic. So it's just multiple touch points that do lead to success.
I do want to say it is impressive that your team actually talks to the patients, because that is not something you hear all the time, and it's important to call that out, that engagement. And I think on the patient side, that engagement makes a difference.
Correct. And it goes beyond just the touch points of engagements. Once we're able to actually even take care of our patients, we're able to fill those prescriptions for our patients. Because we're an accredited pharmacy with ACHC, One of the things that we do, as our model requires us to do, is we have regular touch points with our patients. The time that the patient's picking up their prescription, the pharmacist spends anywhere from 15 to 20 minutes on a minimum to educate them about about their medication. They already have had the training and education with the provider, the physician, or the care team, which includes a PA, a nurse practitioner. We would still have an education session with the patient about their drug expectations, about what adverse drug reactions and perhaps any dose adjustments that might be needed based on their outcomes as they progress in their journey on the medication. Along with that, the pharmacy team also has regular cadence weekly with the patient initially for the first cycle of their treatment. And then prior to the end of each cycle, we have a touch point as well, just to make sure patients are actually taking their medications and finding the clinical benefit. Because what we see, especially on the oral drugs, is the least effective medication is the one that's not taken. So we really have to make sure. I mean, this is a very difficult disease most patients are going through. There's a lot going on externally and internally. And the more we can provide as a resource and be a resource can basically lead to successful outcomes and positive outcomes for our patients.
And so you kind of heard the impact within the system. You're probably wondering, well, what is anybody doing about all of this? Okay. Well, part of my advocacy activities, and I'm one of many, especially when I say that, I've been to Washington, D.C. I've met with Senator Cornyn. I've met with Senator Cruz. I've met with Jake Elsley here locally at his office. I've met with Beth Van Dunn. And this year, earlier this year, guess what we asked for? We asked for, you can keep step therapy, but change two things. Make it electronic so it's easier to get processed, and shorten the time required to respond back. Step therapy and prior authorization, both. We also asked on prior authorization that that it be changed from a legislative perspective so that the doctor is the final arbiter of the decision, not the insurance company. We also talked to all those legislators, and this was in March. We talked to them about extending the Affordable Care Premium Tax Credits. We went and met with them about that. So there is a lot of people and companies and so forth. One company leading that charge is Blood Cancer United. And guess what? You can go too. You've got a story to tell. You've got a family member in pain and suffering. You wonder what the heck you can do about it? Come on. Contact Blood Cancer United. Contact the Pan Foundation. There's all different kinds of organizations who go to Washington multiple times a year, and they want more people, advocates, because the most powerful thing there is your individual story. You'd be amazed at just how much power your story has. So if you want to go and you want to sit across the table from Cornyn and tell him your story and tell him, I put you in office, you work for me, I don't work for you, and tell him what you would like to have changed, I invite you to come on and go with us. We're always looking for more advocates.
I 100% agree with that. We really encourage through local chapters of Texas Society of Clinical Oncology, ACCC chapters, and even COA, which is a national organization where we really request our patients to tell their story and how this disease and any impediments they see that's happening in their care is impacting their entire journey. And the members of Congress and Senate, they do want to hear from you and how they can actually cause a positive impact.
And it's true. I'm married to a lobbyist, so I mean it honestly. It is true though. That's what he does. He trains people to go up to the hill, and it's the personal stories that matter. And it really does. And this is a true example of being able to move the meter. And when you're in the room, you may not feel like something's going to happen, and it might not happen that session. But you told your story, you pled your case, and you've laid the groundwork for change to begin. And that's really helping people know they're not alone and a way to channel and harness what's going on. I do have a question for you about your team. And do you think that your team would be interested in being able to tell the stories that they encounter on a daily basis, you know, with people, with legislators or others?
I think they would. I think that's the only way to make a difference because they're seeing all of the problems that happen, each roadblock that happens, and they're talking with the patients. They're communicating all along the way. So I think that they would like to be able to share those things and even the good things that come out at the very end. Just recently, we had one where the technician got the prior authorization done and had to send it to a Credo. A Credo didn't bill it correctly. Patient needed this medication. They refused to bill it. They needed this medication to go with their infusion. So our team went back and got a one-time override so they could have it minutes before their infusion started. But had my team not been there to help that patient through that process, then they would have been stuck. So I think that they would really like to get out there and be able to share this information.
We're working on this thing for next year.
That's the legislators. Wow, we've covered quite a bit, and certainly the burden to the system, but also the depth and commitment I think that the professionals have on their jobs, but to their patients. The fact that, you know, Zia's team and your team really worked so closely to make a difference in people's lives, to make sure that when that counts, that they're able to get the treatment that the doctor ordered, and if not, that they can work around it, but also how to self-advocate. I think that's really one of the most important things that we take away from this. And so I do want to just kind of wrap things up and, you know, just ask each of you sort of, what are you hopeful about in, you know, being able to change this dialogue and ensuring that patients really are put over paperwork? And start with George.
I would say that change happens very, very slowly and even slower in the Capitol. But change does happen. In 2019, I worked on, I went to Washington to get a cap on Medicare out-of-pocket expenses. This last year, Medicare out-of-pocket expenses were capped at $2,000. That was part of the bill that me and thousands of other people advocated for, called the Inflation Reduction Act. It happened. It does happen. I'm hopeful about change, even though change takes forever. I'm also hopeful about two things personally. One is clinical trials and research. If no one was out there doing research, I wouldn't be here today. It's the research that got the next pill and the pill after that and the pill after that, and the clinical trials, which takes those drugs and whatever and runs them and tests them to make sure they're safe for consumption and so forth. If those things are not happening, I mean, there'd be a lot of people suffering from that. So I'm very happy that clinical trials are going. If you see something in the media or whatever talking about limiting clinical trials or limiting research, understand that it will affect a lot of people's willingness or ability to survive.
We face a lot of roadblocks all the time in pharmacy, and I work for the state of Texas, so it's a lot of roadblocks all the time. But I have a sign that I bought whenever I first started at UT Southwestern, and it says, "Wait a minute, great things are about to happen." And I've kept that in my office all these years, and I've moved positions and moving around and built this great team. And I'm just excited to see what changes are already happening and what's coming along. So I am hopeful that things will change. As you said, it's slow, but it will happen.
I'll echo what other panelists have said, especially George, what you mentioned about clinical trials. This is a huge part of the cancer treatments that are necessary and are now available that we're able to use for our patients. We see some challenges already in that space where with the recent cuts to the FDA, how that's causing an impact in NIH as well. There's a lot of drug companies that are stepping up and private institutions that are trying to fill in those gaps. But also, when patients are able to seek out talking to their physicians to see, is there a clinical trial out there that is best fit for them? Most physicians will already seek those. But if, being a good advocate for yourself also includes trying to find out if there is an opportunity, speaking with your physician, there is a clinical trial out there that can possibly be a better option. That's always great. I would say, again, with everything that's happening, the more information that's available that our patients are equipped with, that they can help guide that treatment option available to themselves is what we want.
Thank you. And thank you to all of our panelists for their time and their insights. We've learned so much, and I think we have a lot to be hopeful for too. So I'm going to pass this back to Linda.
Thank you. At Cancer Support Community, we believe community is stronger than cancer. And we also believe community can make change. So really powerful, and we will continue to keep forging. So we are going to, at this time, take a minute, allow our panelists to grab a drink of water while we bring up our advocacy partner, Samantha Harris from Blood Cancer United.
My name is Samantha Harris. I am the Patient Community Outreach Manager for Blood Cancer United in the Red River region, right here in North Texas. I want to say it's been an absolute pleasure working with Cancer Support Community to help make this program happen. Thank you for involving us and some of the patients that are near and dear to my heart. At Blood Cancer United, our goal is to cure blood cancers and to support patients through their treatment and into survivorship. The ways that we do that is through research, through policy and advocacy, and through support services. One of our most recent support services that we launched back in September of last year is our medical debt case management service. And through this service, patients can work one-on-one with a case manager to help alleviate medical debt through charity cares, through finding new insurance plans, or in the marketplace, applying for Medicare and Medicaid. They can also help patients work through these problems if they're having denials for their insurance or authorization issues. Our case managers can help patients work with their insurance teams one-on-one to make sure that they can get those things covered. Since September of last year, we have helped alleviate over $4.6 million. And so we hope this program will continue. So if you are a blood cancer patient and you either already have a medical debt or you anticipate that you may get medical debt in the future because of your treatment, you can give us a call. It's 833-507-8063, or you can visit us at bloodcancerunited.org/medical debt case management.
At this time, we are opening the floor for questions. And I will share the mic. The good thing is I'm wearing flats today.
We have
So
another
you're
little one
all
too.
good.
We have the audience mic, and I'll be Vanna.
Just raise your hand.
I have a question for George. George, when you transitioned from private care to Medicare, can you describe that transition and how you made that crossover successful for yourself?
I was getting to work and Medicare is that the insurance I was getting through work had an out-of-pocket limit. So they offer 3 insurance plans, low, medium, and high. I always took the high because I had a lot of stuff going on. And it would have $8,000 a year cap on treatment and stuff. And so when I went to Medicare at that time in 2019, Medicare didn't have a cap on out-of-pocket expenses. So the drug that I took was $14,000 a month. Okay, and right in that neighborhood still today. It was $14,000 a month for that drug. And then the Medicare catastrophic tier, which is the final tier that you end up in after you spent a bunch of money. In that tier, you're still responsible for 5% of the total cost of the medicine. That was in 2019. So I was still paying $600 a month just for one pill. And with my illness, I was taking, 10, 15, 20 pills a day for all the other side effects that the illness caused. And so I was paying a lot of money a year, and that's aside from the premiums. So I was paying well over $15,000-$17,000 a year in medical costs between the out-of-pocket stuff and the premiums and all of that. When I went to Medicare, the Medicare changed with the Inflation Reduction Act. It's capped at $2,000. So when I get the $2,000, I'm done for the year, and I usually get $2,000 in January. So that's kind of. But back then, I couldn't plan for it. I couldn't budget for it because I didn't know whether when I went to the doctor, he was going to say, "Oh, George, we need to add a pill." Oh my gosh, how am I going to pay for that now? So there was a lot of sleepless nights trying to figure out, number one, how I was going to pay for all of the cost of the drugs and stuff, and then number two, what's the future like? I have to worry about the additional drugs and additional.
Other questions? Wait, so that the virtual audience can hear your.
This is a question for anyone that can answer. What are your recommendations and support for those going through perhaps a mental health crisis when all of this happens at the same time? I cannot imagine all those sleepless nights going through your diagnosis and all the other questions. If you have any advice for those patients that don't even know where to go or what to do.
Two things. Number one, your doctor treats your physical illness. If your doctor's not supporting your emotional and mental side at the same time, find a new doctor. Okay. What I mean by that, it could be something as simple as when you go to the doctor's office, if the doctor says, "Hey, how are you doing? How's your family? Oh, what are you making for Thanksgiving?" If you're not having those type of conversations, what's keeping you up at night? What is there something I can give you to help you sleep better? Is there a resource I can send you to help you get over those different stressful times? If you're not having that kind of relationship with your doctor, change doctors. Okay. I think the other important thing is get into a support group. The Blood Cancer United has a support group. I'm a member of their support group. There's people in that group that are blood cancer survivors. They've all had different issues. They've had different challenges. They have ideas on how you can overcome those challenges. There's all kinds of support groups out there. There's support groups for anything you got going on in this room. There's a support group out there for it. It may not be all Blood Cancer United, but I promise I've heard of and met people from different support groups, so it's out there. That's the two things I would recommend.
I don't have much more to add, but, you know, with the getting you the right provider that would speak to all of your wellness, that would be the best thing. UT Southwestern will send you to one place or another, you know, to make sure that you have that coverage.
I'm gonna tell you a lot. Well, you can listen to me, or I can tell you about bone marrow transplants and things like that. A lot of,
You'll remember. You'll remember.
So, excellent question, and what we heard tonight is that it's already stressful to be diagnosed with cancer, and then try to figure out how you're going to access medicine in your treatment. And that could add a stress, right? And that's why it's important, most cancer centers do the stress screening, where they will look at depression risk, depression, anxiety, and also how practical concerns, insurance issues, financial concerns, barriers, transportation may be also a factor in impacting the patient. And so it's really important to, one, see if you're getting screened. If not, you could always, call Cancer Support Community Helpline or go to one of our 200 locations where we have licensed mental health professionals on site, and also through our calls, who will screen and also link it to support. Again, the amount of stress that a patient deals with coping with the diagnosis, and on top of having to make, as I was listening, multiple calls, and being aware and monitoring how that impacts one is very important. So it is also, and also insurance may get involved in terms of accessing mental health and so on. But there are advocates, and again, free services that are available through the resources that are in the Any other questions from our audience in person here? Otherwise, I do have a question from online. Our question is, what would you tell a patient who is newly diagnosed and dealing with the stress about their insurance?
I was in a support group session last weekend, and a man walked in with his wife, and someone said something to the effect of, what is your illness? And the husband, who was the caregiver, said, we have CML, okay, or whatever the illness is. You need to start thinking about your illness as we have cancer, okay? Tell your family, next time you're at Thanksgiving, you're at Christmas, what's going on, how are you doing? Oh, we are doing well with our cancer treatment. Bring them in, the family, the community, your coworkers, they drop by your desk, how you're doing? Oh, we are doing well, and if you'd like to come and join me during my next treatment, you have an open invitation. So I would say that. I would say you're not alone. You are not alone. Okay, if you are struggling with debt, figuring out how to get paid for something, if you've got children and you're trying to figure out how should I tell the children, you are not alone. You're not the first person that's ever happened to. If you don't want to tell your 87-year-old mother that you got a diagnosis because it might kill her, you're not alone. Okay? Just reach out, and there's all kinds of organizations out there that are standing by hands open, ready to help you. You just simply have to reach out to find them, and they're all out there on the internet, so they're easy to find.
I can add to that too. I would say the same, what George is saying. We don't expect every patient to be in the same situation financially, and that's never going to happen. And we always encourage our patients to tell us if they're dealing with anything that, you know, is stressing them out, whether it could be possibly childcare, could be transportation, could be lodging. Because in our center, we see patients that are traveling 300, 400 miles just to come see us. We have a dedicated room, I would say it's a special unit within our building where patients that have young children, and sometimes these are young parents who unfortunately got diagnosed with a cancer, and they have young children who don't know how to navigate that disease and understand what their parents are going through. It's a lot of stress that it's not just the patient, it's their partner, it's their loved ones, it could be their children that are also dealing with. And in our team, we try to ask those questions to the patients to extract that information about what is their situation, how can we help, what are the resources that we can provide, are there financial resources they need, are there some non-financial resources they may need, some emotional, you know, could it be counseling, could it be any kind of therapy, and there are those options available. A lot of practices have those resources within their network. Drug companies have a lot of resources within their network that they that oftentimes we reach out to try to find out how we can provide those for our patients. And ultimately, you know, it's sometimes difficult to talk about the disease and the position the patient might be in. That's why we encourage, when we train all our staff, to ask those questions and get that information to put them at ease and hold their hands when there's all these challenges that they're facing. Because once they leave the clinic, they have a life to go back to. There are other challenges that they're already dealing with in their life, and this is not going to make those go away. So how can we be an advocate for them is the question that we ask ourselves every time.
That is so inspiring to hear that you want to be able to help your patients and you are delivering on it. And Deanne, you and your team are making that concerted effort. And George, you are just a walking hope. You are like walking hope. You're a ray of sunshine. And I mean that because, I mean, I've learned quite a bit tonight about, just all the work that goes on behind the scenes and the commitment to the patients and the healthcare teams and what can happen when, dedicated people come together. And I just want to thank you all for being here with us. I'm going to turn it over back to Belinda, but, let's give our panelists a round of applause. Thank you again. This was a really great conversation.
Yeah, thank you. And she has to.
I know Dr. Patrick Haskell from working with them at Texas Oncology for 18 years. And I would like to say being an advocate really helps the patients tremendously. I was an advocate for Texas Oncology for the longest time. I left and I'm with Texas Health now. I have the best experience. And I want to say, me being a patient now, unfortunately, being a breast cancer patient, when one of my drugs was going to be denied, I already knew the pattern of what to do, and I told my doctor, "Oh no, go ahead and send it through. I already know the steps. It'll get approved, believe me." And the doctor and the advocate put in the little ground to get it approved. It helps tremendously. I literally can say, because of the advocates I have had a very non-stress with all my treatment. So,
Thank you.
yeah.
The way that advocates themselves, they also be part of a community and share information, support groups through different activities that help strengthen the community to be able to raise their voices together to address the issues that are important. So thank you for sharing that. And tonight was amazing. It was inspiring, but I also know it let us know we still have work to do. And we are uniting here to really speak up about these issues, and we'll continue to do so until change happens. Okay. So thank you all I want to thank our panelists and our speakers for being here today, and this was such an insightful conversation. And as we wrap up, I wanted to highlight the document that you received. This is a call to action toolkit created for those who are here in Texas. So it's created just for our Texas location. This resource was created to help you feel confident, prepared, and supported when insurance decisions delay change or deny treatments your doctors have recommended. So inside you'll find a simple guide to understand your insurance, step-by-step actions to take when care is blocked, and information on how to report these issues to the state and federal agencies. On the last page of our resources, you can access through our website with lots of helpful information for you as well. As we said, you are empowered when you have information. And if you are interested in having that voice to advocate for others, please also look on our website that there's opportunities and ways for you to do that and be engaged and support the community. Life with cancer can be hard, and it shouldn't be made harder by having to fight through an insurance process. So we encourage you to take those toolkits home, share them with others. We have extra, and use it to help make your voice heard. Together, we can protect patients to be able to have access to care that they need right here in Texas and throughout the United States. So thank you again. Once again, I want to thank our sponsor, B1, for supporting this very important work for our patients. And so I thank you all. There's plenty more to eat. Enjoy the night. Continue the conversation.
Thank you.